Now we're moving into the features of renal disorders. Here's a quick comparison table that helps us differentiate conditions based on blood pressure, plasma renin, aldosterone, serum magnesium, and urine calcium. For example, syndrome of inappropriate antidiuretic hormone secretion, or SIADH. Blood pressure is normal or increased. Plasma renin is normal or decreased. Aldosterone is normal or decreased. Serum magnesium is normal. Urine calcium is normal. Bartter syndrome. Blood pressure is normal. Plasma renin is increased. Aldosterone is increased. Serum magnesium is normal. Urine calcium is increased. Gittleman syndrome. Blood pressure is normal. Plasma renin is increased. Aldosterone is increased. Serum magnesium is decreased. Urine calcium is decreased. Renin-secreting tumor. Blood pressure is increased. Plasma renin is increased. Aldosterone is increased. Serum magnesium is normal. Urine calcium is normal. Primary hyperaldosteronism. Blood pressure is increased. Plasma renin is decreased. Aldosterone is increased. Serum magnesium is normal. Urine calcium is normal. Little syndrome and syndrome of apparent mineralocorticoid excess. Blood pressure is increased. Plasma renin is decreased. Aldosterone is decreased. Serum magnesium is normal. Urine calcium is normal. That's why this chart is so useful. It gives you the important differentiating features at a glance. Now let's move to the second part, relative concentrations along the proximal tubule. Think of the proximal tubule as a moving conveyor belt where solutes and water are being reabsorbed at different rates. On the graph, you'll see tubular fluid concentration compared to plasma, or TF over P, plotted along the length of the proximal tubule. Here's how to interpret it. If TF over P is greater than 1, that means the solute is either reabsorbed more slowly than water, or it's actually being secreted. If TF over P equals 1, that means the solute and water are being reabsorbed at the same rate. If TF over P is less than 1, that means the solute is being reabsorbed faster than water. Now, let's place some substances on this graph. For glucose and amino acids, their concentration falls below 1 early because they are completely reabsorbed in the proximal tubule. For bicarbonate, its concentration also falls below 1 because it is preferentially reabsorbed. For osmolarity, sodium and potassium, their concentrations stay right around 1 because they are reabsorbed proportionally with water. For chloride, the concentration rises above 1 in the early proximal tubule, since sodium is being reabsorbed along with bicarbonate instead of chloride. Later, chloride reabsorption catches up and the ratio levels off. For inulin and creatinine, their concentrations rise above 1, since neither is reabsorbed and water is being removed, so they get more concentrated as you go along the tubule. Creatinine can rise even more than inulin because it is also secreted. For urea, the concentration also rises above 1 because water is reabsorbed more quickly than urea in the proximal tubule. For parminoiopuric acid, or PAH, the concentration rises the most because it is not only filtered but also actively secreted into the tubule. Finally, remember that tubular inulin increases in concentration, but not in amount, as you move along the proximal tubule, since water is being reabsorbed. Chloride reabsorption occurs at a slower rate than sodium in early proximal convoluted tubule, and then matches the rate of sodium reabsorption more distally. Thus, its relative concentration increases before it plateaus.